Good day to all. Today we'll be tackling about family planning. Before we start our discussion, we would know some of the context in this webinar. First, we have what is family planning? We would know what family planning. What is the purpose of family planning? Things to consider during family planning. The modern methods of family planning. Importance of family planning, and the best contraceptive in family planning. First, let me introduce myself. I am Oswald Roble, and we will be tackling about family planning. So, what is family planning? Family planning is the consideration of the number of children a person wishes to have, including the choice to have no children, and the age at which they wish to have them. Things that may play a role in family planning decisions include marital situation, career or work considerations, financial situations, and if sexually active, family planning may involve the use of contraception and other techniques to control the timing of reproduction. Family planning has been of practice since the 16th century by the people of Guinea in West Africa, when physicians advised women to space their births of 3-year intervals. Other aspects of family planning aside from contraception include sex education, prevention and management of sexually transmitted infections, preconception counseling and management, and infertility management. Family planning, as defined by the United Nations and the World Health Organization, encompasses services leading up to conception. Abortion is not typically recommended as a primary method of family planning, and access to contraception reduces the need for abortion. Family planning is sometimes used as synonym or euphemism for access to and use of contraception. However, it often involves methods and practices in addition to contraception. Additionally, many might wish to use contraception but are not necessarily planning a family. Family planning has become a catch-all phrase for much of the work undertaken in this realm. However, contemporary notions of family planning tend to place a woman and her childbearing decisions at the center of the discussions, as notions of women's empowerment and reproductive autonomy have gained traction in many parts of the world, and it is usually applied to a female-male couple who wish to limit the number of children they have or control pregnancy timing, or also known as spacing children. Family planning has been shown to reduce teenage birth rates and birth rates for unmarried women. Next, we'll tackling about the purpose of family planning. In 2006, the U.S. Center for Disease Control, or CDC, issued a recommendation encouraging men and women to formulate a reproductive life plan to help them in avoiding unintended pregnancy and to improve the health of women and reduce adverse pregnancy outcomes. There are multiple benefits to family planning, and including spacing birth for healthier pregnancies, thus decreasing risk of maternal morbidity, fetal prematurity, and low birth. There is also potential positive impact on the individual's social and economic advancement, as raising a child requires significant amounts of resources like time, social, financial, and environmental. Planning can help assure that resources are available. For many, the purpose of family planning is to make sure that any couple, man or woman, who has a child has the resources that are needed in order to complete this goal. With these resources, a couple, man or woman, can explore the options of natural birth, surrogacy, artificial insemination, or adoption. In the other case, if the person does not wish to have a child at a specific time, they can investigate the resources that are needed to prevent pregnancy, such as birth control, contraceptives, or physical protection and prevention. There is no clear impact case for or against conceiving a child. Individually, for most people, bearing a child or not has no measurable impact on personal well-being. A review of the economic literature on life satisfaction shows that certain groups of people are much happier without children, like single parents, fathers who both work and raise the children equally, singles, the divorced, the poor, those whose children are older than 3, those whose children are sick. However, both adoptees and adopters report that they are happier after adoption. Things to consider in family planning. First, we have the resources. When women can pursue additional education and paid employment, families can invest more in each child. Children with fewer siblings tend to stay school longer those with many siblings. Leaving school in order to have children has long-term implications for the future of these girls, as well as the human capital of their families and communities. Family planning slows unsustainable population growth, which drains resources from the environment and national regional development efforts. Next, we have next to consider is our health. The World Health Organization states about maternal health that maternal health refers to the health of women during pregnancy, childbirth, and the postpartum period. While motherhood is often a positive and fulfilling experience, for too many women it is associated with suffering, ill health, and even death. About 99% maternal deaths occur in less developed countries, less than one half occur in sub-Saharan Africa, and almost a third in South Asia. Both early and motherhood have increased risk. Young teenagers face a higher risk of complication and death as a result of pregnancy. Waiting until the mother is at least 18 years old before trying to have children improves maternal and child health. Also, if additional if additional children are desired after a child is born, it is healthier for the mother and the child to wait at least 2 years, but not more than 5 years, after the previous birth before attempting to conceive. After a miscarriage or abortion, it is healthier to wait at least 6 months. When family planning, women should be aware that the reproductive risk increase with the age of the woman, like older men, older women, have a higher chance of having a child with autism or Down syndrome. The chances of having multiple births increases, which cause further late pregnancy risk. They have an increased chance of developing gestational diabetes. The need for a cesarean section is greater, and the risk of prolonged labor is higher, putting the baby in distress. Lastly, to consider is the finances. Family planning is among the most cost-effective of all health interventions. The cost savings stem from a reduction in unintended pregnancy, as well as reduction in transmission of sexually transmitted infections, including HIV. Next, we will tackling about the modern methods of family planning to be discussed by Mr. Archie Rim.
Here the next the modern methods of family planning. Number one is contraception. Contraceptions, a number of contraceptive methods are available to prevent unwanted pregnancy. There are natural methods and various chemical based methods, each with particular advantage and disadvantage. Behavioral methods to avoid pregnancy that involves vaginal intercourse include the withdrawal and calendar-based method, which have little upfront cost and are readily available. Long-acting reversible contraceptive methods such as intrauterine device, which means IUD, and implant are highly effective and convenient, requiring little user actions, but do some with risk when cause of failure is included. Odds and vasectomy are much less costly than other methods. In addition to providing birth control, male and or female condoms protect against sexually transmitted disease. Condom may be used alone or in addition to other methods as backup or to prevent SID surgical methods. Tubal ligations vasectomy provide long-term in contraception for those who have complete their families. The next is the assisted reproduction technology. When we say the assisted reproductive technology, when for any reason a woman is unable to conceive by natural means, she may seek assisted conception. It is recommended to the couple to ask for reproductive counseling after 1 year of trying to conceive, or after 6 months of trying if the woman is more than 35 years old, if she has a regular or infrequent since, if she has an history of endometriosis or pelvic inflammatory disease, or if a problem related to the male is present. Some families or women seek assistance through surrogacy, in which a woman agrees to become pregnant and deliver a child for another couple or person. This is not allowed in all countries. There are two types of surrogacy: traditional and gestational. In traditional surrogacy, the surrogate use her own eggs and carries the child for her intended parents. This procedure is done in a doctor office. Through intrauterine insemination, this type of surrogacy obviously includes a genetic connection between the surrogate and the child. Legally, the surrogate will have to disclaim any interest in the child to complete the transfer to the intended parents. A gestational surrogacy occurs when the intended mother's or a donor egg is fertilized outside the body and then the embryos are transferred into the uterus. The woman who carries the child is often referred to as a gestational carrier. The legal steps to confirm parentage with the intended parents in general is easier than in a traditional because there is no genetic connection between child and carrier. Next, fertility awareness. Fertility awareness it is refers to a set of practice used to determine the fertile and fertile phase of a woman's menstrual cycle. These methods may be used to avoid pregnancy, to achieve pregnancy, or as a way to monitor gynecological health. Methods of identical infertile days have been known since antiquity, but scientific knowledge gained during the past century has increased the number and variety of methods. Various methods can be used, and the sympatothermal methods has achieved success rates over 99% if used properly. These methods are used for various reasons. There are no drug-related side effects. They are free to use and only have a small upfront cost. They work for both achieving and preventing pregnancy, and they may be used for religious reasons. The Catholic Church promotes this as the only acceptable form of family planning, calling it natural family planning. Their disadvantages are that either abstinence or a backup contraception method is required on fertile days. Topical use is often less effective than other methods, and they do not protect against sexually transmitted infections. And the last is media campaign. Media campaign, it is a recent research based on national representative survey supports to a strong association between family planning, mass media campaigns, and contraceptive use, even after controlling for social demographic variables. The 1984 Kenya Demographic and Health Survey found half of the women who recalled hearing or seeing a family planning message in radio, print, and television consequently use contraception compared with 14% who did not recall family planning messages in the media. Even after age, residence, and socioeconomic status were taken into account. The Health Education Division of the Ministry of Health conducted the Tanzanian Family Planning Communication Project from January 1991 through December 1994, a project funded by the U.S. Agency for International Development. The program intended to educate international development, both men and men of reproductive age about modern contraceptive methods. The major media channel and products include radio spots, radio series drama, Green Star logo promotional activities, sites, identify sites where family planning services are available. Poster, leaflets, newspaper, and audio cassette tools in conjunction with other non-project intervention sponsored by other Tanzanian international agencies. From 1942 to 1994, contraception use among women aged 15 to 49 increased from 15.4% to 11.3%. The total fertility rate dropped from 6.3 lifetime birth per individual in 1991 to 1992 to 5.8 in 1994.
The importance of family planning. Every couple or individual has the freedom to choose how many children they want to have and the freedom to decide the timing and spacing of any pregnancy. Family planning lets couples and individuals protect themselves and their families' well being in significant ways, such as
and pregnancy complication can be minimized. Family planning helps protect women from any health risk that may occur before or after childbirth. This includes high blood pressure, gestational diabetes, infections, miscarriage, and stillbirth. According to studies, women who bear more than 4 children are at increased risk for maternal mortality, so they need to plan accordingly. Women who get pregnant after the age of 35 are vulnerable to health risks, so they should be protected through careful planning as well. Also, by reducing unintended pregnancies, family planning also removes the option for unsafe abortion. Next is adolescent pregnancies can be reduced. Females who are 10 to 14 years old are more likely to have a preterm baby or a baby that's born before the 37 weeks of pregnancy have been completed. Also, a baby born to a teenage mother will have higher rates of neonatal mortality. And family planning, and more specifically contraception, can protect teenagers from physical, emotional, and financial burden of unplanned pregnancy. Next is infant mortality rates can be cut down. When a pregnancy is unplanned, ill-timed, or too closely spaced, it affects the mother's health, which in turn affects the health and safety of her unborn child. Moreover, an infant will have a greater risk of death and weak health if the mother dies while giving birth. Next is sexually transmitted infections can be prevented. So in sexually transmitted infection, the proper and consistent use of male and female condoms protects an individual both from unplanned pregnancy as well as sexually transmitted infections such as HIV, AIDS, gonorrhea, and chlamydia. Next, people get educated and empowered. When a people or individual is aware of their rights and know what their options are, they can make sound decisions in life. Family planning can help a couple or an individual decide on what's the best for their sexual and reproductive health. By carefully spacing pregnancies, a couple can build financial security, allowing them to raise a family that can properly care of. A family that is properly cared for is a healthy family, and a healthy family is the foundation of a healthy community. So, next we proceed to best contraceptive for family planning. So, first of all, contraceptive. Birth control, also known as contraception, is the use of medicines, device, or surgery to prevent pregnancy. There are many different types. Some are reversible, while others are permanent. Sometimes can also help prevent sexually transmitted disease or STDs. First example of contraceptives are male condoms. So what is a condom? So a condom is a thin covering that fits over a hard penis. It decreases the risk of pregnancy and sexually transmitted diseases or infections or STDs by stopping sperm and body fluids from passing between partners. So, how do I use a condom? First, put a condom on before you have any sexual contact. Use a new condom every time you have sex. Never use two male condoms together or a male and a vaginal condom together. It increases the risk of both condom breaking. Next, never use condoms. Store them at room temperature and out of direct sunlight. You can store latex condom in a wallet for up to 1 month. Next, most condoms are lubricated. This helps prevent breakage and can increase feeling. If you want more lubrication, use water or silicone-based lubricant, but check the label first. Next is, don't use all products, especially, for example, body lotion, petroleum jelly, and etc. with a latex condom because it will break. So, next are benefits of using a condom. Some advantages of using condoms. When used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. Where to avail a condom? You can get condoms from drugstores, Planned Parenthood health centers, community health centers, doctors' offices, supermarkets, convenience stores, online or any stores that are available, and even from vending machines. You don't need a prescription and there's no age restrictions. Anyone or anybody can buy condoms. Next is sterilization. So, what is a sterilization? So, sterilization is a permanent method of birth control. Sterilization procedures for women are called tubal sterilization or female sterilization. The procedure for men is called vasectomy. Sterilization is considered a safe procedure with few complications. So, how is sterilization done? For men, vasectomy is the only option for sterilization. During straightforward surgery, the tube that carries sperm into the semen are cut and sealed. Women may choose sterilization options such as tubal ligation, a surgical procedure that permanently blocks the fallopian tubes. So what are the benefits? So for men and women who no longer want to have children, sterilization offers a permanent, safe, cost-effective, and efficacious ways to prevent unintended pregnancy. Male sterilization is common than female sterilization, but both are nearly 100% effective at preventing pregnancy. Where to avoid sterilization? You can get a tubal ligation at a doctor's office, hospital, or health clinic. Many Planned Parenthood health centers also do some types of sterilization procedure. If your local Planned Parenthood doesn't do tubal ligation, they may be able to refer you to other healthcare providers in your area who do. Some chose to get sterilized right after giving birth or having an abortion. Talk with your doctor ahead of time if you want to combine sterilization with another procedure. Depending on where you live, there may be age restrictions or waiting procedures, and etc. Next is the calendar method. So, What is a calendar method? So, calendar-based methods are various methods of estimating a woman's likelihood of fertility based on a record of the length of previous menstrual cycles. Various methods are known as the Gino method and the Rhythm method. So, how to use a calendar method? Before you can use the calendar method as birth control, you need to keep track of the length of your menstrual cycle for at least 6 periods. You can do this with a regular calendar. Here's how you do it. Mark the first day of your period. This is day 1. Then, mark the first day of your next period. Count the total number of the days between each cycle. The number of days between the first days of each period. You must chart at least 6 cycles, but charting a few more months is even better. If all of your cycles are shorter than 27 days, the calendar method can be accurate for you. Benefits of calendar method. So, the method provides contraceptive protection, which is 45% effective between days 1 to 7 of the menstrual cycle and from day 20 to the commencement of next period of menstrual bleeding. Where to avail calendar method? You can do it yourself. This method will only work by you. Next is withdrawal method. So what is withdrawal? So withdrawal, also called pulling out, is when a male removes his penis from the vagina before he ejaculates during sex. How does withdrawal work? So by trying to keep sperm from entering the vagina, a person using withdrawal hopes to prevent pregnancy. Advantage of withdrawal. Withdrawal works by keeping semen out of the vagina, which makes other forms of birth control even more effective. No matter what birth control you use, pulling out helps your method pack an even bigger pregnancy preventing punch. Where to avail withdrawal method? The pull-out method is a free, convenient, hormone-free to prevent pregnancy. No trips to the doctor or pharmacy necessary. It depends on how you control it for it to be effective. So number 5 is hormone implant. What is a hormone implant? The contraceptive implant, Nexplanon, is a small flexible rod that's placed under the skin in your upper arm by a doctor or nurse. It releases the hormone progesterone into your bloodstream to prevent pregnancy and lasts for 3 years. How does a hormone implant work? A contraceptive implant is placed under the skin of the upper arm. The implant releases a low, steady dose of progestational hormone to thicken cervical mucus and thin lining of the uterus, called endometrium. The implant typically suppresses ovulation as well. So, advantage of hormone implant. It works for 3 years. It doesn't interrupt sex. It's an option if you can't use estrogen-based contraception, such as the combined contraceptive pill, contraceptive patch, or vaginal ring. It's safe to use while you are breastfeeding. Where to avail hormone implant? You can get the implant from your local Planned Parenthood Health Center or from another nurse or doctor. You may be able to get your implant for free at low cost.
In behalf of my group mates, this is Oswald Roble, together with Mr. Archie Rim and Mr. Masalven M. Sereno. Thank you and God bless.